Assalamualaikum. My name is Dr. Imtiaz Ali Sario, and today we will discuss history taking of headache. First of all, we will ask the patient onset of the headache, whether patient have headache sudden in onset or he has gradual in onset. If patient have headache with sudden in onset and he has associated vomiting, then there is possibility that patient have subarachnoid hemorrhage. And we will also ask about the whether it is gradual or sudden. Then we will ask about the site of the headache, whether the patient have unilateral headache or bilateral headache. If patient have bilateral headache and especially it is at evening time, then there is possibility that he has tension headache. Then we will ask about if patient have unilateral headache, then there is possibility that patient might have cluster headache or migraine. And we will also ask about the retroorbital pain. If patient have headache with associated with retroorbital pain, there is possibility that he has migraine or cluster headache. Then we will ask about the other associated symptoms of the migraine and cluster headache. If patient have unilateral headache and he has scalp tenderness or he has headache in temporal region, then there is possibility that patient have temporal arthritis. In subarachnoid hemorrhage and meningitis, patient have occipital, sudden, and signs of meningism are also present in these patients. Then we will ask about the character of the headache. Is if you have pain, what type of character it is, whether it is throbbing, tight, or shooting. Then we will ask about the duration of the headache. How long you have headache? Like in migraine, usually there it lasts about 12 to 24 hours or up to 72 hours, while cluster headache typically minutes to hours. Migraine usually lasts about 12 to 24 hours, or there is possibility that it can occur up to 72 hours, while cluster headache occurs minutes to hours. And also, if uh, in acute glaucoma, headache can also occur associated with eye pain. Then we will ask about the radiation of the headache pain. If patient have meningism and pain radiates towards neck and shoulder, then there is possibility that patient have meningitis. In temporal pattern is if the patient have a headache and if it works in morning time, then there is possibility that patient have raised intracranial pressure, and if it is at the end of the day, there is possibility that patient have tension headache. Then we will ask whether does it wake up you from the sleep. If patient wake up from the sleep, then there is possibility that patient have cluster headache. Then we will ask about the associated symptoms of the headache. Does you have sudden loss of vision? If patient have sudden loss of vision, there is possibility that patient have acute glaucoma or Giant cell arthritis. If patient have diplopia or visual field defect, there is possibility that patient have pituitary tumor. In migraine, usually there is presence of aura. Aura means patient have visual, sensory, and olfactory symptoms, uh, and also patient have photophobia and limb weakness. These symptoms are the aura symptoms. We will ask about these patient if we are suspecting migraine. Patient have unilateral headache with retroorbital pain and with these symptoms, then we can label clinically that this patient have migraine. Then we will now we are talking about cluster headache. If patient have unilateral headache with retroorbital pain and there is association with lacrimation, eye redness, drooping of eyelid, or runny nose, then we can conclude that he might have cluster headache. If patient have fever, neck stiffness, photophobia, and rash, then there is possibility of meningitis. In Giant cell arthritis, patient have scalp tenderness, jaw claudication, and proximal uh, weakness. if patient have morning headache, nausea, vomiting, these if and a neurological deficit, then we can make the diagnosis of raised intracranial pressure. This is all about the history taking of headache. Hope you have learned from it. Thank you.